procedure by which we are going to defrost the eggs that the patient froze in the past with the idea of creating the embryos. So those eggs will be fertilized with the patient's partner sample or with a sperm donor sample to create the embryos at the laboratory for a future embryo transfer. The procedure is exactly the same, so we will fertilize the eggs that will be previously defrosted at the laboratory. We will create the embryos, and depending on the treatment the patient wants to undergo, we will decide if we can do the embryo transfer with a fresh embryo or not. What we normally do is, if the patient agrees in doing the first embryo transfer with a fresh embryo, the patient should undergo a treatment to prepare the uterus to have it in the best conditions possible. After that procedure, we will defrost the eggs, they will be fertilized, and the embryos that will be created at the laboratory, we will select the best quality embryo to do the embryo transfer. However, if the patient prefers to undergo what we call the pre-implantation genetic screening, she doesn't need to start her preparation until the embryos are ready. So we defrost the eggs, we create the embryos, and we do a small biopsy on the embryos to check them in terms of the chromosomes. After having suitable embryos to be transferred, the patient will start her preparation to transfer that embryo. Well, according to Clinical Tambre's data, I can tell you that the majority of patients that decide to come to our clinic to do egg freezing is because of social reasons. So many patients prefer to postpone their wish of becoming mother for some years, and they prefer to freeze their eggs because they know that the result will be much better. Of course, some other patients may decide or may need to do that treatment because they are going to undergo maybe treatments that will be toxic for the ovaries. And in the end, they know that it can also affect the future fertility. So because of that, they prefer to also freeze their eggs. But I would say that almost 90% of our patients decide to do it because of social problems. Well, everything will depend on the age the patient decides to freeze their eggs. If she has come in a good age, I mean when they are young, the result will be much better. It means that we would need a lower number of eggs to have a positive outcome. So if the patient is young, the egg quality is supposed to be also better. So because of that, we recommend patients to come, if possible, if they are younger than 35 years old. Well, as we were mentioning before, the results will be different depending on the age the patient decided to freeze their eggs. If the patient froze their eggs when she was young, the result will be better. But if she's doing the treatment when she's in her 40s, the result will be almost the same if she's doing the treatment with fresh eggs at that moment or with frozen eggs that she has froze at that moment also.